The variant is prevalent among current COVID-19 cases, but it isn't the only variant doctors are watching.
WDRB's Dakota Sherrick learned how the variants are tracked and what can stop more mutations. Dakota.
Right now, the World Health Organization is monitoring some COVID variants of concern, variants of interest, and several others.
On occasion, you'll get a variant in the virus, which is basically a mutational change in the virus.
Infectious disease specialist Dr. Mark Burns says all viruses want to replicate. In that process, mutations or errors can occur, some of which end up being inconsequential.
Others, however, can make them a little more lethal and a little more transmissible. Okay, and those are the ones, those particular mutations are those variants that occur. That's what makes us concerned.
Dr. Burns says in a majority of cases when someone with COVID is tested, those specimens are sent to a lab for genetic sequencing to determine what type of COVID a person has. Currently, the World Health Organization has Alpha, Beta, Gamma, and Delta listed as variants of concern. 5 others, including Lambda and Mu, are considered variants of interest.
The Lambda variant, however, that was over in Peru. That doesn't appear to be becoming as transmissible as we thought it would. So, which is a good thing.
But Mu is being found in many specimens, what Dr. Burns calls isolates.
In Colombia, in South America, it's in a large number, so in over 70% of the isolates there. And so they realize that it is now problematic because it is showing up, and now it's starting to spread throughout the world.
Mu has been found in the U.S., but makes up less than 1% of cases. Burns says the vaccines are still effective against Mu and other current variants, though the variants do decrease the efficiency some.
This goes on long enough. Eventually, the variants will work their way or evade the protections that we have from the vaccines. And at that point, it is extremely problematic.
For Burns, the simplest solution is for everyone to get vaccinated.
So that these viruses cannot reproduce, they cannot mutate, because if they don't replicate, they won't mutate, and then it would eventually die out.
Dr. Burns did tell me one of the newer variants was discovered in May this year, currently known as C12. It's been found mainly in South Africa and has spread to Eastern Europe. Dakota Sherrick, WDRB News.
Dakota.